We are Group 9, and we're going to tell you a little bit about heart disease and stroke. In class, we talked about pharmacy having a well-established role in the treatment of heart disease and stroke. We found a video showing a pharmacy that's taken a leadership role, and we'll be following their story throughout the presentation.
South Birmingham PCT is tackling inequalities in male life expectancy across Birmingham with a cardiovascular risk assessment service known as the Heart MOT. The PCT is engaged with Lloyds Pharmacy and independent community pharmacies to deliver an easily accessible service that enables early identification of men with high risk factors.
There's good published evidence that show that community pharmacies are very good at accessing the well public, really. 94% of the public visit a pharmacy each year. In terms of the number of pharmacies, well, we've got 71 in NHS South Birmingham. You're never more than a mile from a pharmacy. They're always open. You don't need to make appointments. So when it comes to choosing where you're going to put a cardiovascular service, that's sustainable in the longer term and can fit into a broader strategy, you'd be silly not to think of community pharmacy as one of the areas to.
So we'll start with some background information on heart disease and stroke. Heart disease is the leading cause of death in the United States. The largest proportion of heart disease is coronary heart disease, and there's 12 million people suffering from this. Mortality from heart disease and stroke can be affected by gender, as we saw in the video, or race. High cholesterol is a major risk factor for coronary heart disease, and there's 90 million people with high cholesterol in the United States. 50 million of those are in need of medical attention, meaning there's plenty of patients and plenty of opportunity for pharmacists to get involved. Now let's talk about stroke. A major form of stroke is cerebrovascular disease, and this occurs in about 4 million people. There are 600,000 stroke cases every year. 1/3 of those lead to death. About 30 years ago, heart failure emerged as a chronic disease, and it's a major risk factor for stroke. Individuals that are age 65 and up have higher mortality rates due to heart failure and stroke. So what causes stroke? A major risk factor for coronary heart disease, stroke, and heart failure is high blood pressure. Unfortunately, the symptoms of high blood pressure sometimes aren't even detectable by the patient. That's why it's known as the silent killer. And of the 50 million people that have high blood pressure, some of them may not even know. As we said before, pharmacy's role is well established in treating heart disease and stroke, and now we're going to talk about some of that documented impact that we've already had. Let's see what kind of tests were being done to monitor heart disease back in Birmingham.
Typically in a month we deliver about 10 healthy heart MOTs. A typical screening session is made up of about 4 components. First part is the blood pressure reading, second part is the cholesterol test itself, where it generates cholesterol reading, and the third component is lifestyle advice, which is tailored individually to that patient, and finally a score of the cardiovascular risk assessment score, which is basically the patient's risk of developing cardiovascular disease in the next 10.
Pharmacists have had a documented impact with education, intervention, and research. There has been a stroke prevention education program, and it actually targets prescribers. This was just recently started in October by the National Prescribing Service, and it focuses on warfarin therapy to prevent stroke. APHA has published a 1-page pamphlet for pharmacists called A Pharmacist's Guide to Aspirin Therapy for Cardiovascular Disease Prevention. It's been available since 2005 and has different statistics and information related to heart disease and the use of aspirin therapy, and there's also a patient version as well. Pharmacists have had a documented impact in a Canadian hospital. They intervened in the stroke care unit, and more than 80% of patients that weren't previously on an ACE inhibitor or angiotensin receptor blocker drug ended up on those therapies solely based on the pharmacist's recommendation, and this greatly optimized the therapeutic outcome for those patients. Pharmacists have also shown a documented impact with research during various clinical studies assessing the effectiveness of medications. For example, there was a clinical study in the Romanian Journal of Neurology that tested the role of antioxidant treatment for stroke. Pharmacists were also involved with doing research on aspirin to see if it could be supplemented by clopidogrel. This was in the New England Journal of Medicine, and while they found that aspirin worked well by itself in preventing heart disease and stroke, adding clopidogrel didn't really have an effect. Now let's see what challenges and opportunities present themselves for pharmacists involving heart disease and stroke. Challenges a pharmacist may run into are patients that just don't want to change, lack of compensation for our services, time constraints, the physical space available in the pharmacy, lack of information or training on our part, and lack of support from the management. How much does it really cost to set up a heart disease monitoring system? Let's go back to Birmingham and find out.
If you're setting up a service covering around 25 pharmacies and you were buying in all the hardware, all the IT, all the marketing, all the training, and actually paying the providers as well, in the first year, which would deliver around 2,000 clients screened, you would pay about £100,000. And what do you get for that? Well, I suppose at the end of the day, every time you do get someone into the NHS, get them onto treatment, then potentially you're preventing a heart attack down the line. So it's actually a very cost-effective way when you work it out in terms of patient cost.
Heart disease is the leading cause of death in the United States, so there's definitely going to be patients out there that want to change and want to get better. Pharmacists have the opportunity to become board certified in pharmacotherapy and specialize in cardiology. There's also residency programs for postgraduate year 2 in cardiology. Heart disease and stroke actually share a lot of risk factors such as high blood pressure, high cholesterol, cigarette smoking, and overweight obesity. Pharmacists can actually have an impact with all of these risk factors, whether it's doing blood pressure screenings, cholesterol screenings, blood glucose screenings, or just promoting smoking cessation. There is also a nutrition support pharmacy specialty, which could of course help with the overweight obesity risk factor. You can work with patients to improve their medication adherence to make sure that they manage their high blood pressure or high cholesterol. You can also educate patients about heart disease, stroke, and all the risk factors so that they have the information they need. What can we take away from all of this about the future of heart disease and stroke? Healthy People 2010 describes 2 primary efforts in heart disease, which are population studies and public outreach. Pharmacists have a unique role in each of these and also in primary prevention of heart disease in the future. Pharmacists don't only need to be aware of statistics about heart disease and stroke, but if they're doing blood pressure clinics, cholesterol clinics, smoking cessation in their pharmacy, they should report their findings so that we can compile data and recognize trends. Pharmacists also need to recognize socioeconomic and racial ethnic disparities. Before, we talked about how the mortality rates differ among different genders and different racial groups. For instance, we know that the risk for heart disease is higher in African American and Hispanic populations, but we need more information on different groups so that we can better treat them, and pharmacists can help compile these statistics. Pharmacists can take an active role in the future of heart disease and stroke with public outreach. We should continue programs that are already in use, such as the blood pressure or cholesterol screenings or the smoking cessation programs. We should also focus patient treatment on education and primary prevention because a lot of the risk factors for heart disease and stroke are preventable. We can do this with medication counseling to improve patient adherence. We can counsel on nutrition and diet and encourage physical activity. We need to educate patients so that we can make sure that they're aware of what the risk factors for heart disease and stroke are. In summary, these are all ways that pharmacists can change their roles to benefit the future of heart disease and stroke treatment, from medication therapy management to emphasizing heart disease and stroke prevention during counseling, from doing a residency in cardiology to getting the board specialty of pharmacotherapy specializing in cardiology, or completing a smoking cessation certificate program. Most importantly, we need to play an active role in the healthcare team, whether it's intervening in the hospital for stroke patients, like we talked about in our documented impact, or simply reporting statistics, like we said was important to do, so that we can recognize trends for heart disease and stroke.